Yesterday, February 4th, was World Cancer Day. And the question that most parents have is what causes cancer? Now, the truth is that children do have cancer right from, when they're infants and then even as they grow older. And we know that cancer is when the body cells grow uncontrollably out of proportion on their own and they can spread to other parts of the body. Now, these are all body cells, tissues, right? The blood vessels and different tissues in the body, they grow uncontrollably. And when they spread to other parts of the body, it's bad. It's called a malignant cancer. And when it doesn't spread, it's benign. Now, the thing is that for children, most times the cause of cancer in children is unknown compared to adults where we can easily do screening and pre-diagnosis. We can screen early detection by screening. For most cancers in children, we're not given that opportunity to screen on time, and so the child just presents with symptoms and this diagnosis is made and is really heartbreaking. Now, other risk factors for children would include if the mother was exposed to radiation in pregnancy, that's a risk factor. If there's a family history of cancer, so if somebody has cancer of the eye in the family, then that's also a risk factor. And then certain syndromes like Down syndrome can predispose a child to cancer. Certain conditions like HIV, hepatitis B infection, and even human papillomavirus infection can predispose a child to cancer. So what are the things that you would find? Now, for certain cancers, let me start with the very one that you can actually detect just using your phone, just using a flashlight. You remember taking some pictures and you now see your pupil, that's the black part of your eye, red in those pictures because of the flashlight. Now, that is what happens normally. But children with cancer, that red part, that red that you see during a flashlight appears white. We call it the cat eye reflex. So it's white because that of the tumor that is there, so it's opaque, is not allowing the flash from the light to pass through. So that's one of the early ways that retinoblastoma can be detected, through taking pictures with a flashlight. Other ways, early diagnosis symptoms are the child will complain of headache, severe headache that is characterized with early morning vomiting, right? Very throbbing headache and the child vomits early in the morning. Severe weight loss. The child loses about 10%, more than 10% of the child's weight, unexplained weight loss. Fever for months that is not remitting. Those are symptoms that can be seen. And sometimes when most of the diagnosis we've had for nephroblastoma is when the mother is beating the child, you now see that there's a mass in the abdomen. Those are one of the ways that it can easily be diagnosed. And it's very important, early diagnosis is important so that treatment can be made and these children have the opportunity to live their lives. Our prayer and hope is that our children stay healthy and strong and God keeps them all. So now you know you can do better. Cheers.